Hey, Dr. Swainey, can a doctor cut off your opioid pain medicine?
Absolutely. Doctor can cut off your opioid pain medicine at any time. The better question is it advisable? And the answer to that is probably not. No. Most people who are on pain medicines have been on them for some time, especially with the increase in opiates prescribed. That's been in the popular press, has led to the opiate crisis, and now we're in a situation where opiates are highly frowned upon. And we had patients who were, being treated for chronic pain for years, and because of the fear of repercussion from the DEA, the prescribing for opiates went essentially down to zero. So unfortunately, that left a lot of people in the lurch. A lot of people didn't have what they had to control their pains, and we've seen quite a few people in that setting where you have a person who has been on a pain medicine for years, and their opiates were stopped, not taken off, and people eventually end up going into the streets buying either oral opiates off the streets or going for heroin, and we get people in a roundabout way through that process. So, can my doctor stop prescribing? Yes. You won't like that. The patient would not like that because, most people who are on opiates are dependent, and if you're dependent, you're going to go through withdrawal if you don't have it. And we detoxed many people off of pain medications who were in this exact setting. They lost their prescription from whatever doctor because the doctor wasn't comfortable prescribing anymore. And the interesting thing is that for the majority of people who we've detoxed, when we get them off of the pain medicine, their actual pain improves. So, which doesn't make a lot of sense because you're looking at someone who is on opiates. We detoxed them, and they're without opiates, and their pain gets better. That doesn't make a lot of sense, but there's reasons for that. One of them is that when you take opiates, it increases your sensitivity to pain. Sometimes that increased sensitivity of pain is a major factor, and people can have big increases in pain, and that can be why you see people have to go up to really high doses of opiates when they're on it for chronic pain. And this is something called opiate-induced hyperalgesia. And the answer to this problem is coming off of the opiates, decreasing the opiate dose. And in our group of patients, we found that to be very helpful in, number one, stopping the hyperalgesia, and number two, improving their pain overall by coming off opiates. If you look at studies on chronic pain, we don't see improvement in function or pain scores with treating chronic pain with opiates. And that was the first big push to get people off opiates in chronic pain, was because we were developing studies that showed, maybe this isn't a good idea. Maybe they don't work like it seems like they should work.